Today I want to take you with me inside the operating room. I'm an international medical student currently doing my master's degree in cardiovascular surgery in China. One of the best parts of my training is that I have the opportunity to attend the operating room almost every day. For me, every surgery is a new lesson, and every case teaches something different. But today's case was particularly interesting and quite challenging. Our patient today was an 80-year-old man who was suffering from two serious heart problems at the same time: coronary artery disease and valvular heart disease. Managing even one of these conditions can be complex, but when both are present together, the surgical strategy becomes much more demanding. After the patient was prepared and anesthesia was given, the surgical team began the procedure. The first part of the operation was coronary artery bypass grafting, also known as CABG. In this procedure, surgeons create a new pathway for blood to reach the heart muscle by bypassing blocked coronary arteries. In this patient's case, two coronary arteries were significantly blocked. To restore proper blood flow, the surgeons placed two bypass grafts. These grafts allow blood to travel around the blocked sections of the arteries and supply oxygen to the heart muscle again. Once the bypass grafts were completed and the heart's blood supply was improved, the team moved on to the second major part of the operation. The patient was also suffering from severe mitral valve disease. The mitral valve plays an essential role in controlling blood flow between the left atrium and the left ventricle. When this valve becomes damaged or severely diseased, it can affect the efficiency of the entire heart. Because the valve was too damaged to repair, the surgeons decided to perform a mitral valve replacement. During this step, the diseased valve was removed and replaced with a biological valve. Biological valves are often preferred in elderly patients because they generally do not require lifelong anticoagulation therapy. But even that was not the end of the procedure. The patient also had tricuspid valve insufficiency. The tricuspid valve is responsible for controlling blood flow on the right side of the heart. When it becomes insufficient, blood can leak backward, which puts additional stress on the heart. To correct this problem, the surgeons performed a tricuspid valve repair using an annuloplasty ring. This ring helps reshape and stabilize the valve so it can close properly again. So in a single operation, the patient underwent three major cardiac procedures: coronary artery bypass grafting, mitral valve replacement, and tricuspid valve repair. For any patient, this would be a very complex surgery. But for someone who is 80 years old, the risk and difficulty become even greater. Fortunately, the surgery itself went successfully. However, due to the patient's advanced age and the complexity of the procedure, the medical team decided to provide additional support after the operation. The patient was placed on ECMO support in the intensive care unit. ECMO stands for extracorporeal membrane oxygenation. It is a life support system that temporarily assists the heart and lungs by circulating blood outside the body, adding oxygen, and removing carbon dioxide. This allows the heart and lungs to rest and recover after major surgery. After the operation was completed, the patient was carefully transferred to the intensive care unit where he continues to receive close monitoring and ECMO support. For me, being able to observe surgeries like this is an incredible learning experience. Watching experienced surgeons handle such complex cases teaches far more than any textbook ever could. Every day in the operating room reminds me how important teamwork, precision, and decision-making are in cardiac surgery. This journey is not easy. The training is long, the cases are complex, and every day brings new challenges.